Hello everyone. In this short clip we will talk about the method 4 for the calculation of the heart rate from the ECG paper, and this will be the last method. We already had studied about the method 1, 2 and 3, and in the coming or the next video we will talk about the understanding of the cardiac rhythm from the ECG. At the end of the video, if you like the video, then do press the bell icon after subscription of the channel, and also try to like and share the video, because this way you will be helpful in growing the channel further. Thank you so much. So this is going to be the method 4 or the last method using which we can calculate the heart rate from the ECG paper. And in this method there are certain points which need to be remembered. These are the important points. Now look at this. This is a one large box. It comprises of the 5 small boxes. Now on the x-axis or horizontal plane there is a duration. Now the duration of one small box is 0.04 seconds. Because one large box comprises of the 5 small boxes, so the duration of the one large box will be 0.04, which is the duration of one small box, into 5, so it will be 0.20 second. This is where so the duration of one large box is 0.20 second and the duration of one small box is 0.04 second. Now if we take the duration of the 5 large boxes, now these are 5 large boxes, 1, 2, 3, 4, 5. Duration of one large box is 0.20 second, and if we multiply 5 with 0.20, the duration of the 5 large boxes will be equal to 5 into 0.20, that will be equal to 1 second. Remember this calculation. Duration of the 5 large boxes will be equal to 1 second in duration. So let's take example where we can use the method number 4. Here we see that this is an ECG strip which comprises of the 30 large boxes. These are the large boxes which are being separated from each other by the black lines. And these 30 large boxes, which because one large box is equal to 0.20 second and 30 large boxes will be equal to 6 seconds. So step 1 for the use of the method number 4 is, step 1 is to identify a 6 second strip or a 30 large boxes ECG strip. Now this is 1, 2, 3, 4 and this key goes on as we end our counting. These are the 30 large boxes or 6 second strip. Then you on a step 2 you count the number of R waves. This is 1 R wave, this is 2, 3, 4 and 5. You count the number of R waves in that 6 second strip or that 30 large boxes strip. Step number 3, you multiply that number. For example, in this ECG strip, that number is equal to 5. You multiply that number with the 10. 10 is a fixed digit. 6 second strip is a fixed digit. The only thing which can vary is the number of the R waves in that 6 second strip. So you multiply that number of the R waves in that 6 second strip with 10 and that gives you your heart rate. For example, in this case the heart rate is 10 into 5 will be 50 beats per minute. So this is very important to remember these 3 steps in order to understand the method 4 of the calculation of the heart rate from the ECG. Talking about the benefits of the method number 4, because all the method 1, 2 and 3 they include they are based on the regularity of the R to R interval. But in cases of the atrial fibrillation there is no R to R interval regularity, so method 1, 2 and 3 cannot be used in cases of the atrial fibrillation. So the method 4 helps the most. Other than the atrial fibrillation, those patients who have developed complete heart block, they have a heart rate even less than 30 beats per minute. So in those cases also we use the method 4. So it makes it one of the most important method to remember, so that we are able to calculate the heart rate looking at the ECG of these patients, especially the atrial fibrillation and complete heart block.